Hello everyone, welcome to my channel. Today in this topic I'll be discussing about one of the most important and most famous homeopathic remedy, that is Stannum metallicum. And myself Dr. Mega from Yogic Homeo Science. I am an homeopath and I am practicing in my own clinic, and I'll be giving the references of the patient from my own experience, and I'll be also talking about the diseases which are really helpful in the treatment of homeopathic medicines. So today I'll be talking about Stannum Met, because Stannum Met is one of the chronic proliferous remedy, because it acts from the head to toe. So there is nothing which you can really think about this is not and this is there, like that. So today's topic is all about the Stannum Met. So Stannum Met was really invented by the Hahnemann, who is a founder of homeopathy, and Stannum Met is an element, and it is also called as tin because it is prepared from the tin. First, we will be talking about the introduction of the Stannum Met. This remedy was first introduced into the Medica by Master Hahnemann, who is also a founder of homeopathy. It was used in the ancient times of various elements till the time homeopathy came into the field. The only use made of it by homeopaths was to worm expilator. Okay, the keen intelligence of Hahnemann is responsible for the wonderful unfolding of and strange properties of this neglected mineral tin. One of the oldest minerals known is an component of this one. In homeopathy, the crude mineral potentized tin is used for the treatment of so many things. If we also use this tin for the treatment of convulsions, epilepsy, neuralgia, paralysis, this kind of chronic affections also. So the Stannum Met is really useful in the treatment of so many uh, diseases. So without any delay, let's move on to the clinicals of Stannum Met. What are the clinicals which are really helpful in the treatment of Stannum Met? So if we are talking about the Stannum Met clinicals, first we will be going to the sphere of action. The chief action of Stannum Met is centered upon the nervous system and the respiratory organs and the female genital organs. So what is the pathogenesis of the Stannum Met? It produces guttural inflammation of mucous membrane, profuse mucopurulent expectoration with cough, bronchitis, etc. On the cerebrospinal system, it leads to the profound prostration, paralysis, convulsion, neuralgic pain. So these are all about the sphere of action and the pathogenesis of the Stannum Met. Stannum Met was the really means only few remedies was identified by the founder of homeopathy, means by Hahnemann. So in that, Stannum Met is one. The Hahnemann has introduced so many medicine, but all the medicines which he has proved in his lifetime is always a kind of bigger remedy, and it is a polycrust remedy, and they are well proven remedy, and they also act on the main sphere of action on our body, like nervous system, like that. So Stannum Met is one of that. If you are really suffering from any kind of nervous system problems or respiratory organ problems or female organ problems, you can think of Stannum Met. If you are new to the homeopathy, and if you are new to the homeopathy's treatment, or you are just curious about how homeopathy works, or how homeopathy is really kind of helpful in the treatment of chronic diseases or in the acute diseases, and why it is not used in the treatment of uh, emergency things, and what are the things which is really considered for an homeopathic treatment, and how does it work, is it really works on everyone, or there is some specification or what. These all are questions all are there in everyone, because when someone who comes means he is almost 20 years, you think that he is still a student, he comes to the clinic and he says, uh, what is homeopathy? Seriously, because I'm hearing about it after the COVID, but seriously, I just wanted the safest and the natural way of cure. So I thought, when I really googled it, I thought that this is the system which can help us in the treatment of which is safe and which is also cures us naturally and within hours. So I just selected this, but I does not know anything about homeopathy, because from all kind of 20 years I'm only taking the medicines of English medicine or allopathic medicine, which is very favorable to us. But now moving on to the homeopathic system, I'm just kind of scared. Is it safe to take, or it has some side effects, or does it really work on every body type, or does it is really helpful in the treatment? Can it really cure my diseases, or it is going to suppress my diseases? There will be so much and so much of questions whoever the person who comes to our clinic, but only 1% of the people will be aware of the homeopathic treatment from the childhood, because if their parents are homeopathic patients, of course they also leave the children's also in the homeopath's hand. Then the children's will be having like, okay, I can take this medicine because from the newborn I am taking this medicine and I am into this medicine, so there is nothing to worry about. So if you are also a kind of people who is really thinking like, what is homeopathy, how does it work, does it really work or not, then this video is for you, and this uh, suggestion is also for you. Homeopathy is a German medicine and it has its own properties. Homeopathy does not have any kind of side effects. There is aggravation factors, that does not mean that that is an side effect of the homeopathy. What are the aggravation factors which I am talking? How you should be differentiating? Now, if you take any kind of painkillers in the allopathic treatment, you get a gastric symptom that was not related to the pain. When you were having the pain, you was not having the gastric symptom, but after taking the medicine for the gastric symptoms, pain symptoms, you got the gastric symptoms as an accompanying symptom. So that was your side effect of that medicine. So this is the side effect. But in homeopathy, what happens is the aggravation factors. Means if we are giving the pain medicine, like if you're having pain in the muscle because of heavy workload and you're tired, so we give the Restox 200 potency. But you are very sensitive and you are an sensitive type patient, but we just prescribed you Restox 200, and because of that, what happens is the pain was like 50% for you, and it was really kind of okay for you. But after taking the medicine after 1 or 2 hours, the pain increases. This is the main peculiar symptom you should be knowing if you're coming to the homeopathy. The pain increases and it will be there for 2 to 3 hours. After that, it comes down gradually. From the increased pain, it comes down gradually and the pain will be gone. This is the homeopathic aggravation. It is not side effect, it is curing that one, and it is one of the good sign according to the homeopaths and according to everything, because the medicine has went to that place and it is acting to cure that problem. So you are also getting a signal that the medicine is working on that area, and you are getting a signal that okay, I'm going to get cured. and you should only tolerate that kind of thing. But for some people there will be no aggravation factors. But if you give the Restox 200 for one patient and that patient takes the medicine, after that, after 5 to 6 hours of taking the medicine, the person says okay, 10 to 15% of my symptom has been come down, or after 8 hours he says 20% has been come down, after one day he says okay 50% has been come down, and after 2 days he says there is no pain, there is only means stiffness or some kind of uneasiness. But after fourth or fifth day he will be saying no, I am completely fine, I am all right. So that is the magic of the homeopathy. So you should never think that there is a side effect in the homeopathy, and there is no side effect in the homeopathy, there is only the complete cure. So even in the palpitation we use the homeopathic medicine, but in the incurable cases, because incurable cases are the cases which we cannot do anything. Only we can do is to make the patient little bit better by giving the medicine, because they cannot bear the pain or the uncomfortness because of that. So this is all about the homeopathy. Moving on to the Stannum Met. What are the clinicals of the Stannum Met? In what all diseases the Stannum Met works? Abdominal disorders, anemia, asthma, chest affections, colic, cough and convulsion, debility, epilepsy and gastric symptoms, headache, hysteria, leukorrhea, menstrual disorders, neuralgia, paralysis, throat and lung affection, uterus, or it can also be used in the female organs, any kind of symptoms. And you can also prescribe this in the prolapse of uterus. In which stage of prolapse I'll be talking in the specific organ thing, because I'll be dealing this Stannum Met for 1.5 hours. So I need a complete and a detailed explanation about the Stannum Met. So if you are new to our channel, if you are not subscribed, or if you are not liked, or if you are not seen any of my videos, please do go to my channel page. You can find all the videos over there, and you can also find lots and lots of diseases with lots and lots of indicated homeopathic medicine for that diseases. So moving on to the second point, that is the makeup of the Stannum Met. Means in homeopathy we also give the treatment by the means we identify that this person is this person is this. So the physical makeup is also important. We call that as a constitution. It is especially suited to the person who have a long growing thing, and there is increased weakness, and with always kind of dark rings under the eyes. This is one of the thing which is very much important, that is dark rings under the eyes. What is the relation with heat and cold? There is no clear cut indication about the fact whether the patient is chilly or hot. So we can give for the chilly patient, and we can also give it for the hot patient. What is the miasm of the Stannum Met? Of course you does not understand the what is miasm of the Stannum Met, so let's not deal with that, because it's an explanation for the common people, so they can understand the homeopathy and the homeopathic medicine in the easiest way. So moving on to the elements from, means what are the causative factors. If these things are present, then the Stannum Met complaints increases, or if these things happen, the Stannum Met complaints really go in the wrong way, like that. One is emotion, fright and dentition, worm infestation and overusing voice. This is one of the things. Why overusing voice, I'll be saying it in the next video when I am talking about the throat affection of the Stannum Met. because it is very much indicated in the respiratory organs. So moving on to the mind symptoms, because wherever you go, whatever remedy you think of, even if it is not well proven remedy, even if the symptoms are not well a thing, and it is only indicated for only one symptom, then also you should be knowing about the mind symptom, because mind is same as the body. So first changes before the physical appearance happens, first the mind symptoms happen, because every patient who is suffering has one or the other thing which is related to their mental health. So the mental health is very much important. So in my all videos, every time you will be knowing about the mind symptom first, then we will be always moving to the physical symptoms. But without the mind symptoms, we will not be moving to the physical symptoms. So there is no physical symptom without the mind symptom, and after the mind symptom you should always take the physical symptom, even if it is one or two. If you have hundreds of mind symptom, but if you have zero physical symptom, then you cannot think of it is a specific remedy. Every time you should be knowing the physical symptom with the mind symptom, then only you can really find out that okay, this is this and this is this. That's all. Moving on to the mind symptoms of the Stannum Met, where exhaustion is one of the main thing. Without exhaustion, there is no Stannum Met that you can really think of, because Stannum Met is a thing where everything is really in the kind of end stage, kind of that kind of thing. Patient is mentally very much sad and despondent. He or she manifests great sadness. This is one of the peculiar symptom of the Stannum Met, because this sadness and the restlessness and the anxiety is so much that we cannot even explain. Whereas a strong disinclination to talk and aversion to company of men. This is one of the peculiar symptom of the Stannum Met. I had heard the patient saying that I really cannot cope up with this person. I does not know why, but I want this person in my life. But I does not know why I cannot tolerate him. I always feel irritated when I see him. Always feel like why this person is in my life, like that. So there is aversion to the company of men. She is anxious, weak, and irritable. Disposition to weep is there. This is one of the peculiar symptom of the Stannum Met. What is disposition to weep? Means they have so much of craving for weeping, means crying, because the patient will be start to cry even if the single thing does not happen to according to them. Because of that, they start really crying, and they will be really so much restless also. Most probably you will see this thing in the humans only, and the boys also cry, but they does not want to cry in front of the uh, anyone. They literally go and starts crying. That time you can think of, because the sadness is been accompanying with the Stannum Met. Great sadness with uh, she is anxious. This is one of the peculiar symptom of the Stannum Met. What is making her go so anxious? Because she always feel like she is weak and irritable. Because she is weak, she always feel like she is uh, not able to do anything. Because of that, everything is going out of hand, and she is feeling so much of irritable. And there is having means they have so much of whenever they feel weak and exhausted, they always feel like crying, because why I am not independent, why I am not strong like others, why I am like this, why everything is happening to me. Even the memory is so weak that they cannot remember the things, and she always feel like crying all the time, because there is indisposition to weep. She feels like crying all the time. and she can really cry at any time because she will be laughing at one moment and suddenly realize that no, she should be not be laughing at this moment because she has so many things to worry about. She starts weeping. So this type of personality will be for the stannum mat. But crying makes her worst. Some symptoms like ignatia, pulsatilla, sepia and everything. Crying, weeping makes them really feel better after really crying out and saying they are suffering to others, or crying, sitting and crying or weeping make their symptom really feel better. But here the crying is making her symptoms get worse. This is one of the peculiar symptom of the stannum mat. Disposition to weep is there. There is continued restlessness with anxiety. This is one of the peculiar symptom of the stannum mat. Means there is continued restlessness, not the restlessness during knee pain, restlessness during fever, restlessness during diarrhea, restlessness during constipation, like that. There is continued restlessness and exhaustion, and because of that the patient is always anxious and with anxiety, fear, and they always feel like why this thing is happening. And her distress of mind ceases as soon as menses begin to flow. These mental symptoms are caused by emotion and fright. Moving on to the headache symptoms of the stannum mat, because I preferably give the stannum mat for the headache because it can cure the long-standing chronic headache which was not at all been able to take care of with so many big remedies. But when I used the stannum mat, of course I was able to take care of it. Stannum mat, I does not use it on every person, but I only use it when I feel like it's peculiar, because if Naxomica, if it is there, I can use it on someone who just say 2 to 3 symptoms for me. Even if I am not confirmed that this person is Naxomica, I'm just going to give it. I'm not having any kind of fear because I know that if Naxomica is indicated, it's going to take care of it. Even if it is not going to take care of it, at least it's going to give 50% of relief to the patient. But with the stannum mat, I cannot take that chances. So those symptoms should always indicate whenever you are giving the stannum mat. So you should be always looking into that, and you should be always a keen and clean observer of the symptoms, because if you are an homeopathic physician, you should be the keen observer, because the patient will not say everything towards you, and you should be the one person who should be taking out all the information from the patient, because continuously tapping his feet, that shows that he is nervous, is anxious, and is kind of getting fear. So that thing, if you ask the patient, he says no, I'm alright, why should I get feared about you coming to your clinic? Because I came to your clinic to get the treatment. Why I'm going to get fear? If I was getting feared, why could I have come here, right? Like that. So you should be always a clean observer. You cannot say that out that you are feeling nervous, I know about it, like that. You can just write it down in your kind of references, that is your observational symptoms. That's all. So moving on to the particulars of the stannum mat, that is the first particular is all about the headache. What are the causation, what is the location, what is the sensation, and how is the character of the pain. Moving on to the causation of the headache. Headache is caused by fright and emotion and some other kinds of aspect also. So moving on to the location, because the causation is mainly by the anxiousness or the weakness or the anxiousness or the exhaustion or the fright or the emotions. Most probably it will be on the emotions only, because whenever the patient go into the emotional stage, they will be unable to come back. they will be unable to cope up with that. So because of that, so what is the location of the headache? Headache over one or the other eye. This is one of the peculiar symptom, means the headache settles down in the eyes. So in belladonna also the headache settle down in the eyes, but here in the stannum met it's different. Headache over one or the other eye means it will be in the left eye or in the right eye. So there is the side affinity also. If today the headache comes in the right eye, you take the medicine and the headache has gone. After 3 days, of course, the headache repeats, and this time it is on the left side. It is not that they should be on the left side only. Again, it may come on the right side also. There is no specific time side, but you can just say that on only one eye the headache goes and settles out. And some people say that it's mostly on the left side of the body, but it's not a fixed thing like bryonia and everything. So what is the sensation of the stannum met headache? Feels as if the head could burst from inward blows, as if constricted by an ant. Means the headache is inside. The patient will be feeling the irritation inside. Means some people like nitromure people will be saying, I'm having an headache, like a character of the pain is like, means the sensation is like some little amber is hitting on my head. So it is an outward sensation, right? So but in the stannum met there will be an inward sensation. Feels as if the head could burst from inward blows, as if constricted by an ant. So this is one of the peculiar symptom of the stannum met. So moving on to the character of pain. Aching pain. There is no stitching pain or jerking pain like that. It is an aching pain. It will be 24/7, because the aching pain wherever you see there will be always 24/7. Aching pain in the temples and the forehead. I had seen stannum met people more on the temples than in the forehead. Temples means sides of the ear. So that are the temples, and it will be mostly on the left side. It is not that peculiar that it will be always on the left side. It may be on the right side also, but it will be only on the one side, not both the side. So this is one of the things, and it will always go and settle down in the eye also. If you are having a left temple pain, left temple headache, then left eye is affected. If the right side is affected, right eye is affected, like that. So the forehead headache is because of the stress, or because of the emotion, or because of the weeping or continuous crying and everything. And that time you can think the forehead headache. And the character is like violent blowing, beating pain, begins lightly and increases gradually to the highest point and gradually declines. And moving on to the abdominal symptoms of the stannum met, because the abdominal symptoms are very peculiar. What are the abdominal symptoms? There is a colicky in the abdomen. First you should understand what is colicky, lack of pain. Means twisting lack of pain. That is the colicky in the abdomen. Means they get a pain as if the abdomen is being twisted like the cloth. So moving on to the location, where it is around the navel, because the location is also important. If it is the left side, or if it is in the right side, or in the navel, or in the upper abdomen, or in the lower abdomen, like that, because we have 9 quadrants in the abdomen. So where exactly the place is the pain is there, first you should be knowing those. So the stannum met says that around the navel. So what is the sensation of the abdominal pain of stannum met? Empty feeling in the abdomen and in the chest. This is one of the important symptom. Means empty feeling, means as if there is some there's nothing inside their abdomen, but there is a pain like that. What is the character of pain? Cramp like pain begins lightly and increases gradually to the highest point and then gradually declines. This is one of the peculiar symptoms which you can see in every particulars. Like in the headache also, I said that the aching pain in the temples and in the forehead, violent blowing, beating pain begins lightly. See, put your concentration here. Beating pain begins lightly and increases gradually to the highest point. It goes to the highest point, means it increases gradually, like the pain will be in 1 2 3 4, so it will go up to the 10. So it increases gradually to the highest point, then gradually declines, means it comes from 10 9 8 7 6 like that. So even in the abdominal symptom, the character of the pain is like that only. Begins slightly and increases gradually to the highest point and then gradually declines. And how is the character of the pain? Is like the cramp like pain. So this also you should be considering of. Then there is nausea and there is vomiting, which is accompanied with the pain in the stannum met, because in the stannum met, if they are having nausea and the vomiting, we can just give it from the odor of cooking food. It is also seen in the sepia. So it has other peculiar symptoms, but when you have empty organ sensation in the abdomen and the pain is gradual lightly increasing and then gradually declines, then there is also a nausea and vomiting thing when there is a odor of cooking food, then you can think of stannum met. There are peculiar aggravation and amelioration factors also for the stannum met. What are the aggravation factor which make the abdominal symptom worst? From drinking anything warm makes the abdominal symptoms worst. This is one of the peculiar symptom of the stannum met. So what are the amelioration factor? By hard pressure and by lying on the abdomen or across the knees. Means if you pressure the abdomen, means if you put the pressure on the abdomen, means the patient just sleeps putting his stomach on the bed, means he just sleeps not on his back but opposite direction. That time he feels ameliorated. And lying on the abdomen, of course, it is one of the symptom. And keeping the legs crossed, this is one of the peculiar symptom. You may be also thinking like why the sepia symptoms are so much coordinating with the stannum met. Of course, sepia is one of the female remedy, but stannum is not female remedy. It is both for both male and female. All the symptoms are almost present, like empty organ sensation in the chest and the stomach, and the things go gradually and come back gradually, and there is nausea and vomiting from the odor of cooking food. Everything is been accompanying, and everything is also seen in the sepia and in the other symptom also. You can also complement this stannum met to the pulsatilla, because it is also an closely similar remedy, because you will be confused, I should be giving the stannum met or I should be giving the pulsatilla. My advice as a homeopath is that then going, if you feel so much of similar peculiarities, then go for pulsatilla, because pulsatilla is used regularly and there is no much aggravation factors when we give the pulsatilla. So first give the pulsatilla in the first visit. When the patient says that okay, my symptoms are gradually decreasing, give the repeated dose or the higher potency. But when you get a standstill of the symptoms, if you does not get a standstill, just go with the pulsatilla and end it with the pulsatilla. But when you get a standstill with the pulsatilla, then it was the similar remedy for the symptoms. It was not the exact remedy for that symptom. Then go for the second remedy which you was keeping, which you was not sure of giving. So that will be the Stannum Met. So you can start the Stannum Met potency where you left the pulsatilla potency. Means if you was giving the pulsatilla 200 and the standstill thing has happened there, you can go with Stannum Met 200. Then you can give the Stannum Met 1M. So the complaints will be taken care of. So there is no need to worry about, because these things happen because now the lifestyle is being so much changed, everything is been mixing up. So we also need to do the intercurrent remedies and 2 or 3 remedies to cure, because there is multiple diseases in one person. It does not come with only gastric symptom, it does not only come with headache symptoms, it comes with multiple things. So we need 2 or 3 remedies also to cure for some patient, not for all the patient. So it was all about the particular indications of the abdominal symptoms of the Stannum Met. Respiratory symptom. First we will be talking about the cough, because in respiratory symptoms Stannum Met is mainly indicated for the respiratory symptoms. First we will be talking about the cough. Then we'll be moving on to the hoarseness of the voice. Then we'll be moving on to the pulmonary tuberculosis. Then we'll be moving on to the difficulty in breathing. Then we will be moving on to the excessive mucus collection in the bronchi. So everything is covered with the Stannum Met. If you ask me, like when do you mostly use the Stannum Met, I'll be preferably saying that I use the Stannum Met when I have an chest complaint. There is all gone empty feeling in the chest, which is also accompanied with the stomach symptom, or it is only the chest symptoms. Then I'll be always giving the Stannum Met, because for the people who is having all gone sensation in the chest or the hoarseness of the voice, I had given the Stannum Met. It has act wonders, means wonders. Of course I had used it only little bit of times. I had not given the Stannum Met in my first prescription only. As per my remembrance, I had given only in the middle, means first I'll be trying out the antidote or antimonium radicum or prionia or gallicar, something like this, which is a polycrust remedy for the respiratory symptoms. But when none other is working out, then I'll be moving on to the specific symptoms after retaking the case, because sometimes giving the most use remedies is only going to cure the persons, because they will be palliated for the longer time. So they will be showing the symptoms which are more intense, but the treatment is not required like this. So I'll be just checking out like this. I does not know about other physician how they will be dealing with, but my way of dealing with my patients is like this, because they come to our clinic trusting us, because for everyone who comes to our clinic, of course theirs will be the first homeopathic medicine. So I does not want them to go through so much and get scared of homeopathy and stop homeopathic medicine. So I just go with the gradual onset. Then I'll be dealing, means when the person really kind of start to trust the homeopathy and start to believe like, okay, it is safe, it does not have any side effect, and we can really use the homeopathic medicine. Then when the patient really get the confident, I take the confidence from the patient and say that I am going to give the deep acting medicine now, so be a little bit prepared. So after that I'll be giving that medicine. So it is my way of catching up with the patient, because for me patients are like friends to me. I does not want to hurt them in any ways. So this is the way. So moving on to the Stannum Met respiratory symptoms. Without any delay, as I already said, first we will be talking about the cough symptoms. So Every time when I'm talking with the cough symptoms, first I'll be going to the location. As I already said that stannum met is not indicated for the left side affection, but 50% you can see that in the burrowing, or sometimes the stannum met patient present the left sided symptoms. So cough location left side of the chest is predominantly affected, means it is more affected than the right side. What is the sensation? Empty, all gone sensation in the chest. There is profound weakness in the chest, which is accompanied by the soreness in the chest. This is one of the peculiar symptom when the cough is there. Your patient will be saying like, I know there is nothing in the chest. Empty, all gone sensation in the chest. That is that. There is profound weakness, means I get so much of weakness after coughing, and accompanied with the soreness of the chest, means it's not even painful, it's not even aching, it's kind of uneasiness like kind of thing. So that was the location and the sensation of the cough symptoms of the stannum met. Moving on to the character of pain. Stitching pain in the left side with short respiration, means the patient will be unable to breathe. This is the short respiration which we can talk about stannum met, where the character of pain is like stitching pain, means the patient will be always saying like there is stitching pain in the left side of the chest more predominantly. That is the main symptom, means you should not be considering like, okay, the stannum met means the symptom should only appear in the left side, not on the right side. No, it is not like that. The stitching pain in the left side with shortness of the respiration is seen in the stannum met. And I'll be going much deeper in the character of pain. There is rawness and soreness. This both is there in the larynx and trachea, with smartening sensation all the way down when coughing. This is kind of the patient sit down when they have the cough. They say that I'm feeling so uneasy. I feel that my throat is so raw and I cannot literally talk because there is some pain in the trachea. So this is the symptom. And when you talk to the patient, of course the patient does not want to talk to you back because it increases the coughing. Because of that, the pain may begin lightly and increases gradually to the highest point, and then subside and disappear gradually in the same manner as it has appeared. I had already said it is one of the peculiar character of pain of stannum met, means the pain anywhere you can go with, even with the mind symptom, even with the headache symptom, even with the abdominal symptom. I had already said begins lightly and increases gradually to the highest point, then gradually declines. This is one of the peculiar symptom. So moving on to the cough symptom, the pain may begin lightly and increases gradually to the highest point, and then subsides and disappears gradually in the same manner as it appeared. I think everyone understood. Means stepwise it goes. I had already explained. It goes away the same manner which comes. Means first it started with the dry cough, then sputum, then the decrease will be like sputum will be gone, dry cough will be present, then the dry cough goes away like that. Means if you take the sentence like disappears gradually in the same manner as it appeared, this is the meaning of that. Okay, and then what is the character of the cough? Deep cough, it is hollow like that. Shuddering, means the patient beside him will be like, why is coughing like this, and they also feel like I cannot take the breath, strangling kind of cough. And the cough is in the 3 sentence, means like that. Means it comes in rhythm 3 times. If you start coughing, not one cough, no, 3 times. So that is there in the stannum met. It's also a kind of peculiar. You can also see this in the cupramet. I had already dealt with the cupramet cough. Cupramet cough also I said the same thing. Means there will be continuous cough in an paroxysm of 3 times. Cough in 3 kind of hoarseness of the dry cough. This is kind of thing. Means 3 times the patient will be coughing. Then you can really identify. And the hoarseness of the sound is very weak because stannum met is of exertion, weakness. Wherever you go, you cannot leave the weakness. So weakness always accompanies the symptoms. What is the character of the sputum? Means the discharge from the cough. There is accumulation of great quantity of mucus in the trachea, easily thrown off by coughing. Expectoration of profuse white mucus like white of an egg. Yellow green pus with sweetish salty taste in the mouth during the day. So this is the character of the sputum. Means the patient will be saying there is large quantity of mucus in the throat, means in the trachea, which can be easily removed while coughing. Means some patient will be saying that the mucus is there inside, but when I'm coughing or when I'm trying to let it out, it's not coming out. So this is also one of the symptoms which the patient will be saying, but it is opposite in the stannum met. Means easily thrown off by coughing. Means the sputum only comes out while they are coughing. Expectoration of profuse white mucus. This is one of the peculiar because it's an metallicum. So expectoration of profuse white mucus. You can also identify it like white of an egg. Like that it will be. In some patient it will be yellow expectoration. In some patient it will be green pus when there is infection also kind of accompanied. And the patient will be saying like, what is the taste? Of course, not everyone will be the keen observer. The patient, they will be saying, are you kind of this? How can you say that there is an taste for the discharge of the cough also? Some patient will be saying it is sweetish or it is salty taste. They say sweetish when it is yellow or white of an egg, salty when there is a green pus. This is one of my clinical observation of respiratory symptoms, of cough symptoms of stannum met. So salty taste in the mouth, and this thing means the sputum expectoration which is thrown out while coughing is done only during the daytime. During the night time there is only coughing, dry cough kind of thing. So this is all about the cough symptoms of the stannum met. There is inexpressible weakness in the chest. She is so weak that she is unable to talk. I already said the patient does not want to talk to you because they feel so weak in their chest because of coughing. They say that, oh okay, don't talk to me, I does not want to talk to you. So this is one of the reaction which the stannum met patient gives us when we go near to talk to them. When they are ill, we will always go and show the concern, right? So when we go and show them the concern, they say that, can you really go away because I'm already not feeling well, why are you coming and disturbing me, like kind of thing. So what are the modalities, what are the aggravation factors and the amelioration factors of the cough symptoms of the stannum met? From talking, from singing, from laughing while lying on the right side, drinking anything warm. This is the aggravation factors, because during the cough, of course, drinking anything warm should make the symptom ameliorated, but here they get aggravated. So it is one of the peculiar symptom of the stannum met. because stannum met patients are not even a chilly or hot, so he does not want it to get aggravated from the warm drink, but it is getting aggravated by the warm drink. So what are the amelioration factors of the stannum met? So moving on to the amelioration factors of the stannum met, from expectoration and hard pressure. This is one of the peculiar symptom of the stannum met. So moving on to the hoarseness of the voice, which is very much helpful in the stannum met. So moving on to the what are the causative factors? Causation due to paralytic weakness. It is one of the causative factor. So what are the sensation kind of thing? Weakness is also manifested in the voice, because I had already said, if you are seeing the stannum met patient from head to toe, there will be weakness. Even in the fingers there is weakness, even in the ears there is weakness, even in the eyes there is weakness. They open the eyes with the weakness like that. You can see the weakness as if it is their system which is always with them like that. Sensation is weakness is also mentioned, is also kind of seen in the voice. So what is the character? Hoarseness with loss of voice. Local vocal cord will not respond. Talking makes him feel weak. I already said they does not want to talk because of the empty sensation in the chest and hoarseness, everything. There is deep hollow and hollow kind of voice. What are the modalities which make the symptom worst? Worst from using the voice, and better by coughing. Expectoration reveals hoarseness. Next, moving on to the pulmonary tuberculosis. As the thing is showing you for the sweat, I forgot to identify put the name as pulmonary tuberculosis. I just put it as sweat, so it's okay. I'll be explaining about pulmonary tuberculosis. Stannum met is useful in warning of pulmonary tuberculosis. It is also a wonderful palliative in this disease. There is a history of increasing weakness, means pay the attention here. There is a history of increasing weakness, means the gradual increase of the weakness. You can see the history is there, and catarrhal condition and weakness, and there is sweat with fever. The body is so weak, shallow and pale face kind of thing. How is the sensation? There is all gone, empty feeling in the chest, so weak that the patient is unable to talk. What is the character of the cough? There is difficulty in breathing with means the patient will be like while talking, means they cannot even talk, they cannot even breathe like that. Violent rocking cough and gagging kind of thing is there, and intense suffering. What is the character of the sputum? There is copious thick yellow bloody sputum, and expectoration taste sweetish. This is one of the peculiar symptom of the stannum met. Even the sweat is sweet. So I had already said that the sputum is also sweetish, so the expectoration taste sweetish. Chest is filled with mucus. He coughs and expectorates, and yet some sputum remains, because there is a very large collection of sputum. There is accumulation of great quantity of mucus in the throat, and easily throws off by coughing. Expectoration of profuse white mucus, which is like in a color like white of an egg or yellow color maybe, or sometimes it will be also green pus with sweetish or salty taste in the mouth, and all the things happen during the daytime. So this is all about the respiratory symptoms of the stannum met. If you're having so much of respiratory symptoms and there is so much of weakness with all gone empty sensation, and there is a mucus and there is 3 times coughing, you can think of Stannum MET. So moving on to the sweat symptoms of the Stannum MET, because it is also most indicated thing of the Stannum MET. So there is exhausting night sweat, because the cough and the expectoration is during the daytime, and nighttime what the patient will be suffering is with exhausting night sweat, because nighttime there will be not much temperature which is compared to the daytime. The patient will be not sweating during the daytime, it will be comparatively less compared to the nighttime. There is exhausting night sweat with increased in the temperature, and perspiration principally on the forehead, because the headache is also on the temples and sometimes on the forehead. So on the nape of the neck also, means on the neck you can also see the sweating more during the night time, and there is so much of weakness due to the sweat thing also, and smelling very offensive, and every time aggravation is from every morning at 4 a.m. So what are the aggravation factors in the night time? And drinking warm water, lying on right side, drinking anything warm. So this is one of the aggravation factors of the Stannum MET when it is indicated for the sweat symptoms. So exhausting night sweat with increased temperature, and there is an perspiration forehead on the nape of the neck. This is one of the peculiar symptom of the neck symptoms of the sweat symptoms of the Stannum MET. So moving on to the female organs. Before that, I'll be talking about the other symptoms. During the nausea and the vomiting, the patient also start to sweat very much, and during the cough also the patient always start to sweat, and the sweat is not in the armpits but the sweat is in the neck, the nape of the neck. Sometimes the patient will be saying that it is so offensive they cannot even tolerate, and it will be also making their collar shirt become yellowish, because yellowishness for the sternum secretion is like there. So it is there. So the sweat symptoms of the Stannum MET is very much indicated, because the patient will be having this kind of symptom also. Means, of course, it is an acute symptom, means no one comes towards you for the sweat symptom, but they come saying that, oh, why it is happening to us, doctor? Is it something which we should be taking care of, or it is an indication of some other big diseases? No, it will not be. After you take the Stannum MET in the lower dose, of course your sweat symptoms will be able to get controlled, and the yellowishness also goes away. So there is no need to really get so scared. But you are the Stannum MET, because of that you get the little symptoms also feel like irritated, because there will be so many people who are having this kind of symptom. So they will be thinking like, is it unusual? Because I see so many people who sweat they does not stain, but why my clothes are staining yellowish or greenish or brownish like this? So it is because of your body type, because of your pH level, because of the things which is going through your body, the secretions of your body. Because of that the reactions are happening, that's all. So once you take care of that, everything will be under normal, so nothing to worry about it. So the Stannum MET sweat symptoms is also like that, so don't worry about anything. There is exhausting night sweat with increased temperature and perspiration principally on the forehead and on the nape of the neck, and which is sweat is like salty smelling, and sometimes it is offensive also. So every time the sweat is more during the 4 a.m. So what are the female genital organ symptoms of stannum met? Because I'll be going deep into the uh, female organs also, because the stannum mat is excellent remedy for the menstrual troubles, as it is indicated in the chest complaints, means the respiratory complaints. The stannum mat is also very much indicated in the menstrual complaints, also menstrual troubles of the female. And moving on to that, before that we'll be talking about an glancing kind of thing about everything. Okay, first we'll be talking about female complaints, then we'll be moving on to the other things. Why it is indicated for the menstrual troubles, we'll be going to know about it now. How is the periods? So what is the time? Too early means the patient will be saying that I know that my period date was on 15th, but every time I get 5 days previous or 8 days previous, like that, the patient complains that the period time is too early. This is one of the peculiar symptom of the stannum met, because getting 2 to 3 days previous it's okay, but 8 days, because the patient does not even get an 10 to 12 days of free time, so they will be so much irritated by their lifestyle. Why this is happening? Every time I am on periods. So too early period is there, and the period does not even stop too early. Means it will be too profuse. So because of that, the patient will be like, only 10 days I'm not getting the period, after that 20 days I'll be totally in a period kind of cycle. So why this is happening? They come and take the suggestion from the doctors. So the period time is too early. How is the quantity? Too profuse means excessive discharge of blood, you can see in the stannum met patient. Means too early and it's too long also. So the blood quantity may be little bit less in some patient, but here it's not like that. It is too profuse. And what happened before periods and during periods and after periods? First we will be talking about the segments, means before the periods. Sadness. Before 2 to 3 days before the patient go into the periods, they goes into the sadness. What are the other remedies which gives us this kind of symptom? One is nitric acid, another one is ammonium carb. This both also give the same kind of symptom, and the sadness before the menses, before the onset of the menses, is seen in the stannum met. What happens during the menses? There is an pain in the malar bones with bearing down sensation. So this is during the menses. What is the character of the pain? During periods, there is pain in the vagina, shooting upwards with great weakness. While dressing in the morning, the patient has to sit down several times to rest. This is one of the peculiar symptom of the stannum met females, because the female means the girls or the women will be like, I'm too weak, because the stannum met is for the great weakness and exhaustion. Of course, when they are around periods, of course they will be in the great weakness. During periods, there is pain in the vagina. This is also peculiar symptom. They cannot even touch their own kind of thing. While washing also there is a pain. And shooting upward kind of pain means the pain goes upward with great weakness, and the patient cannot go to work seriously. Because of that, they will be always asking for the work leave because of this kind of symptom, because they feel like nothing is working out for them, nothing is going according to them, nothing is really working out for them. Like that means there is a great weakness. While dressing in the morning, the patient has to sit down several times to rest. To comb, she should sit down. To dress up, she'll sit down. Of course, in the normal days, this will be not the case. But in the regular days, of course, kind of thing happen. In the female complaints, of course, there are so much of thing which I am not talking about, because in the stannum met, I preferably give the stannum met for the chest complaints, and I does not remember about giving it to the female complaints. But when the periods is accompanied with the chest complaints also, or the headache with empty organ sensation of the abdomen, with chest complaints and sweat and the menses, everything is peeping out for the stannum met, then I give that. But when the patient come with only the menstrual troubles or menstrual complaints, I does not preferably give the stannum met, because we have in homeopathy there are plenty and wonderful remedies for the female complaints. So I'll be always going to them, because I know about the sequence, how they will be playing, how they will be acting up, and how I can manage them up, and how well good results they will be giving us. But why I'm not going for stannum met? Because stannum met has to accompany the weakness, because the weakness is seen in every patient. You cannot differentiate that weakness of stannum met with the weakness of the menstrual problems. If I can literally differentiate, I'll be going to the stannum met, but seriously I will be unable to. When the chest complaints are also accompanied, it gives us some stability that okay, this is stannum met. We can give for the both complaints the stannum met only, so stannum met alone can take care of everything. So when this kind of confidence come in us, we can just prescribe it. So if confidence is not given to us with the symptoms of the patient, of course we will not be literally be able to give the stannum met for the female organs or the menstrual troubles. Moving on to the leukorrhea, white discharge of the stannum met. It also comes in the female organs only. Leukorrhea is also transparent, yellowish, because all discharge of stannum met is almost yellowish mucus with there is so much of weakness also, and great debility, weakness with seems to proceed towards the chest. So this is one of the white discharge symptoms of the stannum met. There are so many wonderful remedy for the leukorrhea, white discharge. This will be the concomitant symptom, that's all. Means if you want to really confirm the chest symptom, you will be looking into another particular which is almost similar for the stannum met. That time if you ask about leukorrhea, if she says this, you can confirm, that's all. If the patient is coming for the leukorrhea kind of treatment, then you can think of other remedies. There is no need of thinking of stannum met. Only for the confirmation of the stannum met, you can go for the leukorrhea symptom. What are the prolapse of uterus symptoms of stannum met? There is bearing down sensation in the uterine region, prolapse of uterus and vagina. The patient is so weak that she drops into a chair instead of sitting down. Sensation of prolapse is aggravated during the stool. Means the prolapse of the uterus happens every time, means during the stool. So the patient will be so much weak to sit down and get up and everything. The patient will be asking someone to help her out, because there is so much of bearing down sensation in the uterine region. So she cannot really cope up with this kind of thing. So she really want to so these are the female complaints of the stannum met. The stannum met is an excellent remedy for the menstrual troubles, and during the menses, I had already said the time is too early to profuse sadness is there before menses. During menses there is a pain and bearing down sensation. The character of pain during the menses is like pain in the vagina shooting upwards, and there is great weakness, and the patient does not want to really stand. They always try to sit even while they are dressing themselves up. And it is also indicated in the leukorrhea, which is yellowish mucus and with the great weakness. And it is also indicated in the prolapse of the uterus. There is bearing down sensation in the uterine region, prolapse of the uterus and the vagina. The patient is so weak that she drops into the chair instead of sitting down. So all the uterine symptoms are aggravated during the stool. This is one of the peculiar symptom of the stannum met. So moving on to the general modalities of the stannum met. What are the aggravation factors? What are the amelioration factors? If you are thinking of stannum met, of course you should always kind of look into the general modalities, because general modalities plays an very important role in selection of the remedies, because some people will be not taking these modalities because they does not know how to take it. But seriously, the general modalities are so important that if you want to identify the patient, if you want to really confirm that okay, I'm going to get and good results from this patient, you should confirm it from the aggravation and from the amelioration factors. So when these things happen, first we will be moving on to the general modalities. That is, what are the aggravation factors? By laughing, while singing, while talking, while using the voice totally. Means singing, talking, laughing, everything is for the use of the voice, right? So if the patient uses the voice, of course he feels so much aggravated kind of thing. So lying on the right side, because predominantly the stannum met is indicated for the left-sided medicine. So there is left-sided affection, but when the patient lies on the right side, the aggravation is been more. This kind of thing happen in so much of patients. So there is no need to really think like it is not the correct way of dealing. Of course it is a correct way of dealing. So what are the amelioration factors? Means what is making the patient better? By coughing or expectorating relieves the hoarseness and heart pressure, because the patient feels so better when there is an heart pressure on the affected side. Because of that, the patient always says that someone come and help me out, because there is so much of weakness in the patient, they cannot even tolerate that kind of heart pressure because of that. So first, it was all about the general modalities of the stannum met. We will be talking into the particular modalities of the stannum met. Moving on to the mind particular aggravation factors. The elements from the mind symptoms are from the emotion, fright, dentation, worm infestations, overusing of the voice. This is one of the peculiar aggravation factors of the mind symptom, because the sad and the exhaustion and the great sadness and aversion to the company of men, anxious, weak, irritable, everything come with this kind of emotion or the fright symptom. There is continued restlessness with anxiety in the mind symptom, which come from the emotion only. Her distress of mind ceases as soon as the menses starts, means the menstrual flow begins. So this is one of the peculiar symptom and also an aggravation symptom of the stannum met. So this is all about the mind peculiar general modalities of mind symptoms of stannum met. Moving on to the headache symptoms, means headache aggravation factors like aggravation and amelioration factors. Modality of headache. Headache is due to the fright, emotion, or so much of thinking. The headache is mostly on the left side of the head, mainly on the temples or on the forehead, which also settles in one side, any eye. It may be any eye. So what are the modality, aggravation and amelioration factors? The aggravation factors are from the motion, from 10 a.m. to 3 to 5 p.m. What are the amelioration factor? By heart pressure, because the pressure really makes the stannum met patient go into relieved kind of thing. Because of that, the patient always say that I want an heart pressure to make my symptoms or the pain get relieved. This is one of the peculiar symptoms which the stannum met patient sees. So what are the abdominal symptoms of the stannum met? What are the modalities like? What are the aggravation factors? What are the amelioration factors? What are the aggravation factors of colic in abdomen, which is mainly around the navel? How is the sensation? Means empty feeling in the abdomen and the chest. What is the character of the pain of the abdomen? Cramp like pain, brings lightly and increases gradually to the highest point and gradually declines. So there is nausea and vomiting also from the odor of the food. So the aggravation factors is from drinking anything warm and also the odor of the cooking food. So this is one of the aggravation factors of the abdominal symptoms of the stannum met. What are the amelioration symptoms of the stannum met of abdominal symptoms? By heart pressure and by lying on the abdomen. This is one of the peculiar symptom. Amelioration from lying on the abdomen and across the knees. So moving on to the respiratory symptoms of the modalities. So there is left side affected more than the right side. Empty organ sensation in the chest, and the cough is so much severe that there is stitching pain, and deep hollow 3-time cough is there. Yellow sputum, sweetish salty sputum is also there. How is the aggravation and the amelioration factors of the cough? Aggravation is from talking because the cough is increasing. So this is one of the great factors of the cough. So what are the aggravation factors and what are the amelioration factors? Aggravation from talking, singing, laughing, lying on right side, drinking anything warm. Of course, the cough symptom should come down when they are drinking warm things, but no, it aggravates because it gives the so much of irritation in the trachea. Because of that, the patients start coughing again when they take the warm drinks. So they all preferably take the normal water. So what are the amelioration factors of the cough symptom? From expectoration, because there is so much profuse mucus, there's large amount of mucus which is there in the chest, so they just want to expectorate it out. Of course, while coughing, the expectoration comes out very easily. And by heart pressure, what they do for heart pressure is they sleep on the chest. That gives the heart pressure for the chest symptoms. So this is all about the cough symptoms of the stannum met, aggravation and amelioration factors. Moving on to the hoarseness modalities. Worst from using the voice, better by coughing. Expectoration reveals the hoarseness of the voice. And this is all about the stannum met, aggravation and amelioration factors of the respiratory symptoms of the stannum met. What are the female genital organs, means menstrual, aggravation and amelioration factors? Moving on to the aggravation factors, the patient cannot really cope up with talking to anyone. Aggravation. Before the onset of menses, they are in so much of sadness, they does not want to talk to anyone. They does not really feel like talking to anyone, and they feel like, leave me alone, I does not want to talk to you. So this is one of the peculiar symptom. And the patient does not want to laugh, does not want to talk, does not want to use their voice for anything. Because some patient I had seen, there is cough symptom which is accompanied with the menstrual troubles. So that time also you can think of stannum met. So lying on the right side makes the symptom so much worse. Because of that, they always preferably lie on the left side or lie on the abdomen during the periods. This makes them feel little bit better. there is always a sensation of something coming out from their uh, thing, and because of that, whenever they passes the stool, they always feel like they are irritated, they always feel weakness, they always feel exhausted. Because of that, it is also an aggravation factors during the menstrual thing. So moving on to the general modalities, the whole modalities of the stannum mat. Aggravation factors are from laughing, singing, talking, using voice, and lying on the right side and drinking anything warm. So the patient is not chilly, not hot, but still they cannot take anything warm. So what are the amelioration factor, or what are the betterment factors which make the stannum patient literally feel relieved or better? Coughing or expectoration reveals the hoarseness and by heart pressure, means the patient sleeps on his abdomen when he is having a pain or colicky kind of pain in the abdomen. The patient sleeps on the abdomen when they are having the menstrual cramps. The patient sleeps on the chest or the abdomen when they are having coughing or the chest complaints. These are the amelioration factors which makes the patient literally get relieved, and they really feel the relief when they are doing this kind of thing. So moving on to the relationship of the remedies, which is most similar kind of remedy which you can compare that with the stannum met. The complementary remedy for the stannum met is pulsatilla. For me, always I go with the cough symptom pulsatilla, menstrual symptom pulsatilla, leukorrhea symptom pulsatilla, abdominal symptom of course I'm not going to the pulsatilla, but mind symptom I go for the pulsatilla. First we'll be knowing what are the similar kind of thing which is happening with the pulsatilla and with the stannum met. Moving on to the pulsatilla's mind symptom, there is always changeability of symptom is there. Stannum met patient are neither chilly nor hot, but pulsatilla are like the same kind of thing, neither chilly not hot, but complementary, they are very much kind of chilly. So moving on to the mind symptoms, they are mild, gentle, and the weakness is running throughout the remedy like that of stannum met, and weeping dispersion is there. But in stannum met, the weeping makes the complaint so get worst, but here she cannot relate her complaint without weeping. This is the kind of thing, but weeping also ameliorate the pulsatilla. This is one of the differentiation when you are thinking. And there is a kind of fear, and fear of being alone, fear of darkness, fear of ghost is there, same as stannum met. So moving on to the headache comparative, the causation of headache is from the overloading the stomach or fatty eating like that. One-sided headache is there, same like the stannum met, especially the forehead and the temple, same like the stannum met, because the forehead and the temples are there for the headache of the stannum met. So what is the sensation? Sensation is also kind of same thing, bursting type of pain and heaviness, weakness, dullness is there, and the patient does not want to be talked when they are having the headache. The same thing with which is covered with the stannum met. So only I am comparing this with the pulsatilla. So moving on to the gastrointestinal tract, means the stomach symptoms of the abdominal symptoms of the stannum met. There is colicky pain in the abdomen, there is also diarrhea, there is stomach symptoms. The patient always complains about the stomach symptoms, but the stomach symptoms are not so prominent, which is comparative for the stannum met and the pulsatilla, so we'll be not talking about it. Moving to the respiratory symptoms, I preferably give the stannum met cough if it is indicated. I first give the pulsatilla, then I follow up with the stannum met. That gives us a wonderful kind of result. So the cough is usually caused by irritation in the pit of the stomach by taking ice cold things and fatty things and suppressed menses, and the sensation is pressure and soreness upon the chest. and there is same kind of thing, means 3 paroxysms of cough is seen in the pulsatilla and with the stannum met. The patient always feel like this thing is not going to end up. So what is the character of the sputum? Expectoration of copious and greenish yellow mucus. I had already said the stannum met expectoration is white of an egg, greenish or yellow mucus. The same thing happens in the pulsatilla also. So moving on to the female complaints, means the menses. Here the time is kind of there in the stannum met, it's too early, but here delayed menses comes too late. What is the duration? Short duration of menses, but there is long duration and profuse menses, but here the quantity is scanty menses. So here you can differentiate it, where leukorrhea is kind of same, yellowish staining and painful, and you can also give in the prolapse of the uterus also. The pulsatilla is indicated, even the stannum met is also indicated. So this is the relationship of the pulsatilla and the stannum met. Okay, we'll also compare the general modalities also. The pulsatilla modalities are aggravation from the warm hair, warm room, warm of bed, but heat in the evening lying on the left side. But in the stannum met, only by warm drinks, that is the aggravation factors. The stannum met get aggravated when they are lying on the right side, but in pulsatilla they are aggravated when they are lying on the left side. So they does not need any kind of hard pressure in the pulsatilla, but in the stannum met they need it. What are the amelioration factors? Cold air and sitting in the erect position, motion, open hair after good cry, because in the stannum met, when they cry the symptoms get worse, but here the symptoms get revealed. Lying on the painful side is ameliorated in the pulsatilla but aggravated in the stannum met. Cold application, cold food, drinks, and the patient is not so thirsty in the pulsatilla. So this is one of the comparative of pulsatilla with the stannum met. If you ask me as a homeopathic physician, when I am thinking of stannum met, I preferably give, if the cough symptoms, mostly I'll give it 99% for the cough symptoms only stannum met. So when I am giving for the cough symptom, first I'll be giving the pulsatilla. If the patient is new to the homeopathy, or if he is my new patient and I'm taking a fresh case taking, after giving the pulsatilla for two times, then I'll be moving on to the deep acting remedy, that is the stannum met with the same potency. So it means I'd stop the potency for pulsatilla 200, I'll be picking up stannum met 200. I'll not be picking up the stannum met from the 30th potency. So many homeopaths will be not getting the result because of wrong selection of the potency. The potency selection is also very much important, because you should be treating the patient wholly. You cannot be thinking like, okay, I started this, okay, I'll stop here, I'll start from the start. No, you're stopping in the mid, means you should pick up from the mid only. So this is my advice for any homeopath who is watching my video. So this is all about the stannum metallicum, one of the mineral kingdom remedy, and also very much a chronic remedy, polycrust remedy, which is highly indicated for the nervous system, respiratory organs, and for the female organs. So moving on to the ending of this video, if you really like my videos, if you had watched any of my videos in my channel, please do like and subscribe, and also share my videos, and also save my videos for the future references for you. If you are new, you can subscribe, because whenever I put a new video you will be notified. And if you have not watched any of my videos, like I had done an peculiar disease for peculiar medicinal indication, like cough stannum met, like that, means leukorrhea, white discharge, stannum met, like that. I'd explained the things. You can just get it in my channel page in the playlist called as homeopathic medicine also. So here I'll be ending my video. I hope that this video was helpful for so many people who are very much new to the homeopathy, who are having a fear to get the homeopathic treatment, thinking that is it safe or is it having any kind of side effects and everything. I hope that I explained everything which is needed for the common people to understand the homeopathy in the easiest way, because understanding the homeopathy is must, because the mentals are the main thing within the homeopathy. So the patient should trust the doctors before they come here, so then only they can get the wonderful results. So of course, we as a homeopath, we try to make the patient understand what is homeopathy and everything, but still the patient has to understand by himself. So this was all about the stannum metallicum homeopathic medicine, which is highly indicated for the cough symptoms. Thank you for watching. Please do keep supporting me and my channel, and have a wonderful day and a wonderful and a fantastic life, because every life is important, everything is important in our day-to-day life. Thank you, bye bye, have a nice day.